Hi, everyone, and thank you for joining us here today. I'm Sonia Lindell, Director of Communications at Florida Policy Institute. The focus of this press conference is to sound the alarm on a recently leaked menu of potential federal cuts to the Medicaid program. The list of cuts, first reported on by Politico, total $2.3 trillion. Before we begin, a few quick housekeeping notes. This briefing is being recorded and it is being live streamed as well. Members of the media will all receive a link to the recording and several additional resources following this presser. There will be time for questions after the last speaker has provided their remarks. There are three main goals of this briefing. First, to summarize the menu of cuts and explain how this would impact the Medicaid program. Second, to highlight the stories of Floridians who could potentially be impacted by these cuts and to hear their stories about their experiences with the Medicaid program. And last, to reiterate how crucial the Medicaid program is and why 55 groups have signed on to a statement of principles defending the Medicaid program in Florida. So first up, I'm going to turn it over to my colleague, Erica Monet-Lee, policy analyst at Florida Policy Institute, focused on healthcare issues.
Thank you, Sonia. And thank you for attending today. I'm Erica Lee, a health policy analyst at Florida Policy Institute. We are an independent, nonpartisan, and nonprofit organization dedicated to advancing policies and budgets that improve the economic mobility and quality of life for all Floridians. So first and foremost, we cannot forget that Medicaid is a critical lifeline for healthcare for roughly 4.2 million Floridians, and the program covers 2 out of every 5 children in our state. A recent analysis by the Kaiser Family Foundation showed that 79% of what was spent on Medicaid in Florida was for the elderly and individuals with disabilities. As Sonia mentioned, there are currently $2.3 trillion worth of cuts being considered to the federal Medicaid program. These cuts include $9.8 billion worth of per capita cuts that would limit the amount of money Florida could receive for its Medicaid program over time. This is extremely concerning because we know that Medicaid promotes economic security and stability, and that timely access to healthcare services is necessary for children's health and development. Cuts to the Medicaid program would come with additional barriers, not only for the Floridians who need access to healthcare, but for the administrative organizations that also help run the program. We really can't afford to take funds away from the program when there are already families that you'll hear from, as you'll hear from later, who often face administrative challenges maintaining their access to this healthcare coverage. So that's a broad overview, but we thank you for being here with us today, and we'll get into more talking about these issues later on.
Great. Thank you so much, Erica. Next up, we have Joan Alker, Executive Director and Research Professor at Georgetown University Center for Children and Families, who will summarize the leaked menu of cuts.
Thanks so much, Sonia. And thanks everybody for being here today to hear about this important issue. As Sonia and Erica mentioned, in the past few weeks, we have seen a number of memos, both long and short, being circulated around town. They're primarily coming out of the House Budget Committee, as Republicans on the Hill, and particularly in the House, are deciding what to do with these major public policy choices that are facing our country. And just to give a little background here, you know, during the presidential campaign, we heard a lot from President Trump about how he would protect Medicare and Social Security. He also said that he would not repeal the Affordable Care Act, but he did not mention Medicaid at all. There was a complete silence on Medicaid. That had led us to fear that Medicaid would be a top target for draconian and harmful cuts. And indeed, that is what these memos confirm. And it is so important for the public to understand the kinds of impacts these cuts could have, which would be truly devastating. So we've seen memos from the Budget Committee that they are considering as high a number as 2.3 trillion with a T cuts in Medicaid funding. That's between a quarter and a third of all Medicaid funding, which would devastate Medicaid as we know it. Now, just a reminder that Medicaid is financed through a federal state share. States operate the program, but Medicaid has essentially two guarantees. There's a guarantee of coverage for those who are eligible in Florida, children, pregnant women, people with disabilities receiving SSI, seniors in long-term care situations. But of course, states can put up red tape to those. But fundamentally, these folks have a guarantee of coverage if they meet eligibility requirements. And states similarly have a guarantee of federal funding that when they spend $1, and in Florida's case, Florida is really guaranteed to get back 57 cents on the dollar. That's based on the state's matching rate. So we'll come back to that in the moment. But sometimes these cuts are discussed as a way to give states more flexibility to manage their program, with the implication that it can be managed more efficiently. Well, cuts of this magnitude would force states to make very painful choices about cutting services, cutting benefits, reducing payments to providers, cutting eligibility. There's simply no way for a state, however much they want to raise taxes, and Florida is not fond of raising taxes, that they could manage their way out of these kinds of cuts. And as a consequence, vulnerable people, including children, people in nursing homes, would be put at grave risk. And as Erica mentioned, in Florida, about 40% of all children are covered by Medicaid. We just did a recent report, and in rural areas, that number is much higher. In rural counties in Florida, 52% of children are covered by Medicaid. That's one of just 6 states in the country where the majority of children in rural areas are covered by Medicaid. 4 in 7 nursing home residents in Florida are covered by Medicaid, and 44% of births. Now, I'll quickly talk about some of the potential cuts that are on the table, and there are many. So I'm just going to summarize some of the most important ones. The most threatening and largest cut that has been proposed, and we've seen this before, we saw this in 2017, is an effort to cap or block grant the program, generating hundreds and hundreds of $billions of cuts, and fundamentally ripping away these 2 guarantees that I described: the guarantee of a full federal partner to pay for Medicaid and the guarantee for beneficiaries. Now, the devil will be in the details, but Florida has reasons to worry. Every state has reasons to worry, but I think Florida has some special reasons to worry about any proposal to cap or block grant the program for a couple of reasons. First of all, we have an aging society, and Florida, of course, has one of the highest percentage of seniors in its state population. And as Erica mentioned, that's where the majority of Medicaid funding is going. So when you have an aging society and a state with many seniors and a growing need for long-term care, and Medicaid is the primary payer for long-term care, the state of Florida will be left with that responsibility with these massive federal cuts and losing the guarantee of that federal partner that they have today, and that has existed for 60 years in the history of the program. Florida is also a very low per person spender, spending $5,181 per person in Florida on average versus $7,593 for the US. This low spending rate would get locked in most likely in any formula that Congress came up with. So Florida would be further disadvantaged from that. Another set of proposals is directed at restricting states' ability to raise their share, that 43 cents on the dollar that I talked about. In particular, there are proposals to restrict provider taxes. These are taxes on hospitals, some states tax managed care companies, to draw down federal Medicaid funds to avoid using general funds. Florida uses though and uses provider taxes. 49 states do. Those could be restricted. Then there are a lot of other proposals, some of which would affect Florida, some wouldn't, a real medley. And last, I want to say, these cuts are not a foregone conclusion. The House margin is very tight, just 1 or 2 members. And Medicaid is very popular. In a recent poll on January 17th by KFF of voters of what they wanted the Republicans to do, cutting Medicaid was the least favorite of 10 priorities mentioned. In fact, only 15% of Republican voters wanted the Republicans to cut Medicaid. So this is not popular and so important to be talking about it here today. Sonia, back to you.
Joan, thank you so much for that overview. Next, we're going to hear from Virginia, who is going to share her experiences with the Medicaid program. Virginia, can you please tell us how Medicaid positively impacts your life, and also what it would mean to you if Congress cut Medicaid and caused you to lose coverage? In particular, sharing what happened when you lost enrollment briefly last year.
Well, just a brief history of me. I have been receiving Medicaid since I was 11 years old. I have muscular dystrophy. I was diagnosed at 8 years old. I was only given 16 years to live by God's grace. I'm 49 now. I'm still kicking. But Medicaid has been a huge part of me being independent. And I, as a teenager, was going through a very rough time at home. Even though my father is a good man, he was the only person helping me, and he had a lot of issues himself that caused a lot of emotional and psychological dangers for me to stay there. So I really needed to get out of that situation and leave home. I was in the hospital with stress, and I was not eating, and it was just a dismal look for my life for the future. I did have a job, and I really wanted to make a life for myself, but the only way for me to be outside of my home was to go to a nursing home with elderly patients and people with Alzheimer's and dementia, and God help them, but it's not a place a 21-year-old wants to live. So with just God's grace, I was able to find an apartment next to my job, and with Medicaid's help, I was able to have home health come every morning, every night to get me in and out of bed so I could and get out of the living situation I was in. And I really feel if Medicaid did not help me, I don't think I'd be living right now. I think I would have gone downhill quite quickly with the lack of hope and just mental stability that I was having. And with that home health, I was able to stay at my job for 23 years. I drove my chair to work every day. It was hard. There was a lot of struggles I went through, but every bit of it was worth it. And I had to leave South Florida to come up here due to other changes and increase the cost of living in South Florida, but I'm still trying to work. I am a bookkeeper now. I do work from home, and it's been a huge thing for me to have being able to be an adult and participate in other people, life like other people, being able to contribute as a person and give back to society has been a real important thing for me to feel worthwhile, as a person. It's just made a huge difference in my drive for everyday life. And if Congress was to cut Medicaid, or government was to cut Medicaid, I don't know how I would live. I have no family to go to. Both my parents are low-income housing. My father is pretty much disabled. He cannot help me at all. My mother is not in the picture. and all my family lives in the western part of the country, and they cannot help me at all. So I would be on my own, and the only choices I have, other than living alone, is to go to a nursing home or independent living center. There are a lot of places that are set up for blind and the mentally challenged, but there's not much for the physically disabled. So my choices would be very, very few, and it would be quite depressing, to be honest, and don't know what I would do. And last year, when we had the brief issue with Medicaid, I was in a lot of stress, and I had to have my aunt pitch in or loan me some money to help pay for my home health care morning and night to get me in and out of bed for 3 weeks until I can get the services back up again. And so it's a very, very important service, the home health care. And just cutting a few hours out of my day, even if it wasn't cut completely, would be very difficult for my aides to have motivation to keep coming, because it's not like it used to be where you could work 2 or 3 hours and have people come. You really need a minimum of 4 hours for people to want to even drive over to help anybody anymore. So I'm not sure. It would be hard for me to find home health to stay if they cut my hours. So.
Thank you so much, Virginia, for sharing your story. And for folks on the call, again, we're going to be sending out resources after the call. And I have a copy of Virginia's story as well. And we will be sure to share that. So thank you again, Virginia.
You're welcome.
Next, we have Latifa, the Reverend Latifa Griffin, a mother whose child is enrolled in the Medicaid program, who is going to provide some remarks, in particular, how Medicaid positively impacts your life and what it would mean for if Congress cut Medicaid and caused you to lose coverage.
Thank you. Thank you all for having me. I wouldn't be able to take care of my son without Medicaid. Medicaid makes it possible to provide care for my son. It makes it possible for him to attend a pediatric extended care. It makes it possible for him to receive the services, the MAFOs, the AFOs, the wheelchairs, the devices that he needs. My son Spencer is 10 years old, and at the age of 2 months, he was beaten and abused by his birth mother. And as a result, he has cerebral palsy and other medical needs because of it. Now, Spencer came into my life when he was 5 months, and he didn't have a prognosis. And so I didn't know what I was getting into by managing his care. But in Pennsylvania, once he was adopted, the social worker explained, his rights. He would always have Medicaid to get him through. And having access to the things you need is most of the struggle when you're raising a child with special needs. So with Medicaid, my son, like I said, he receives his equipment with a timely manner. We were able to use the pediatric hospital in Wilmington, Delaware for his care while having Pennsylvania Medicaid. So it was easy and portable. Here in Florida, the situation is entirely different. And I've been here since in Florida, West Palm Beach, Florida, July of 2023. I moved here from Pennsylvania, and I moved here for work, and I'm still fighting for Medicaid coverage for my son here in Florida. So for Congress to cut Medicaid would mean I would literally struggle to take care of him. I would likely need to quit my job because I would need to stay home due to being unable to afford the services for him without Medicaid. Then I too would become a burden on an already broken system. So as taxpayers pay into the system and it's not functioning the way that it's been intended. So reform needs to happen, but not at the expense of the most vulnerable of our society. So my son and many others, they didn't have a choice in their disabilities. And the least we can do as good neighbors of society is to provide a good quality of life for an already difficult one. So by cutting Medicaid, our politicians are proving to us once again that the most vulnerable among us are just that, vulnerable and will continue to be. And honestly, that's not a life they deserve. So I hope, reform is on the horizon and they reconsider this.
Thank you so much, Reverend, for sharing your story and for joining us today for this presser. Next, we have Andrea, who is going to share her story about losing Medicaid during the recent Medicaid unwind, which was the period after the federal health emergency ended after the pandemic, and a federal protection expired that allowed adults and children to keep their Medicaid benefits during the pandemic.
Yes, thank you so much for having me. I am Andrea Damala, and I am a disabled Floridian who is living in poverty, who sustained a traumatic brain and spinal cord injury from a car accident when I was hit at 50 miles per hour by a driver under the influence. I've been deeply impacted by losing Medicaid coverage. And I came to learn that our harshest lesson is that our healthcare system is incredibly broken at the time when you need it most. Most of my injuries led to daily vertebrae dislocations, chronic muscle spasms, and a nervous system disorder from my brain injury. And I'm still in need of continuous healthcare management. I relied on Medicaid for ongoing treatment for chronic pain, rehabilitation, and prescription drugs. But when the COVID pandemic era of continuous Medicaid coverage lifted, huge numbers of Floridians lost access to needed health care, including myself. You don't realize the blessing and fortune of health until you lose it. It is a never-ending battle with pain and trauma that runs so deep. Yet the war upon us is the state's inhumanity to provide Medicaid and affordable quality health care for low-income citizens like myself. No one is exempt from this tragedy. Life can change instantly. And I really want to make that clear for people who are healthy and may not feel that this pertains to them, because it absolutely does. We are being denied a right to care for our own bodies and our children as well. We are denying physicians their oath to care for their patients while the state does the most harm. Florida is ranked as being one of the worst states for accessible health care and one of 10 states not supporting Medicaid expansion. And we are dealing with uninsured people seeking out temporary solutions, like visiting the ER without having access to preventable health care, nor management, what causes even more issues like catastrophic medical debt and even bankruptcy. Congress has this responsibility and obligation to its people, yet they continue to lead with the most unethical decisions. It's abuse and it's intentional. Studies have proven Medicaid expansion access reduces our mortality rate in preventing diseases that would otherwise go undiagnosed. Which really brings me to the conclusion that Congress wants people to remain sick. They are perfectly fine with those suffering and dying. And when I think of the term impact, I think of the impact that I had to take and I had to feel like a force, like no other when I was hit unexpectedly in a car accident. I also had to take the impact of losing Medicaid coverage, a vital portion of care management. Yet the word impact can define so many other things, like the impact that Congress could make by actually serving its citizens properly. I don't want to just imagine a world that is ethical. I want to live in it. And I will do all I have to do, not only to make that a reality, but to also stand up for those who need a voice. And that is why I advocate for healthcare in Florida.
Andrea, thank you so much for sharing your story. And thank you again to all of the folks sharing their stories to show how absolutely devastating it would be to cut the Medicaid program. So our final speaker for today is Allison Yeager, who is Executive Director of Florida Health Justice Project. Allison is going to talk about groups coalescing around a shared statement of principles to defend the Medicaid program. And as of last night, there were 55 groups who signed on. And after the press conference, in the follow-up email, we will be sharing the statement of principles and the names of all the groups who signed on.
Thank you, Sonia, and thank you, Virginia, Reverend Latifa, Andrea, for sharing your stories and being here. I'm really moved and I'm really grateful for you all for speaking out. And to those who are joining us, good morning. As Sonia said, we are here on behalf of 55 organizations, and undoubtedly it would have been far more if we'd had more time to circulate our sign-on letter. But 55 organizations that have signed on to a statement of principles protecting Florida's Medicaid program. I'm going to repeat some of what we've already heard because the points bear repeating. The Medicaid program in Florida serves as a critical lifeline. We've just heard some really powerful stories from individuals. It's easy when we hear numbers to forget that every number represents faces and real lives. But Florida's Medicaid program is a critical lifeline to 4.2 million residents across our state. And based on what we've heard and what we know, the facts are abundantly clear. Medicaid is not just a healthcare program, it's a cornerstone of our social and economic stability. I'm going to highlight a couple more crucial numbers. More than 3/4 of Florida's Medicaid recipients are children. So we know that losses to the program would have a huge impact on kids, as well as, sorry, I should say more than 3/4 of Florida's Medicaid recipients are children, seniors over 65, and people with disabilities. So we know that losses to the program would have a huge impact on each of those populations, kids, our elders, and as Joan said, the senior population in Florida is matched only with that of Maine in terms of our portion of our population that are elders, and people living with disabilities, people who depend, as Virginia shared, she does every day on folks coming into their homes, providing essential services to allow people to live in the way they choose and with dignity. The program covers 2.1 million children, helps over 700,000 seniors accessing essential long-term care services. And also we know that Medicaid plays a critical role in our rural communities. In rural communities, more than half of all children rely on Medicaid or CHIP for their healthcare needs. We also have seen very recently, COVID is not a distant memory yet, and we saw in the COVID-19 pandemic why a strong Medicaid program is essential. When Floridians faced job losses, Medicaid enrollment increased by 36%. And the program provided at that time, as it continues to do, critical coverage during a time of crisis. And we cannot afford to lose this safety net. Proposed cuts to Medicaid would have devastating ripple effects across our state. They would threaten rural hospitals, many of which are already at risk of closure. We've seen this phenomenon across the country. Cuts to Medicaid would jeopardize essential services for our most vulnerable communities. They would strain our emergency rooms, our public health systems, and ultimately, as Joan said, would increase healthcare costs for all. The state will have an impossible balancing act on its hands, one that we really cannot afford. So we at Florida Policy Institute, Florida Health Justice Project, Florida Voices for Health, and 52 other organizations call upon our elected officials to reject any proposals that would cut federal Medicaid funding and leave our state in an impossible budgetary situation. Floridians are already struggling to take care of their children and their elders and those with chronic conditions, and we cannot afford to lose this lifeline. Thank you.
Great. Allison, thank you so much for wrapping us up there and talking a little bit about the statement of principles. We are now going to move into our question and answer portion. So for members of the media who are on the call, please drop your questions in the Q&A box, or alternatively, you can use the raise hand function and we can unmute you. Now, I think we have the first question already. Do we know how these cuts would impact Florida healthy kids?
I will jump in on that. Hi, everyone. It's Joan Alker again. So we haven't really seen anything that lets us be able to answer that question. So I think that the answer is stay tuned. I will just in sort of some breaking news mention that as many of you may have seen, this memo leaked out last night from the Office of Management and Budget, pausing all federal grant programs for at least 2 weeks to do essentially an ideology check. And I just issued a statement about this. It's not clear if this applies to Medicaid. It very well, the Post just started reporting that it doesn't, but we really don't know. And it very well may likely apply to CHIP. So those funds may be frozen. And that's a really important question that some of you reporters should be asking the Healthy Kids folks right now. But in terms of how federal cuts would impact CHIP, we just don't have the answer to that yet. Now, many states, Florida is actually one of these states because Florida has Healthy Kids funded by 21, but there are a number of combination programs, and Florida is one of them. So like your Children's Medical Services, some of your kids are getting CHIP funding and Medicaid funding, because CHIP is operating off a base essentially of Medicaid funding. So there will be impacts, but we can't answer the question of precisely what those impacts will be yet.
Great. Thank you, Joan. Do we have any other questions? Okay. I know you mentioned there isn't a lot of political support behind cutting Medicaid. Are there specific proposals that have more backing than others? Anything we could expect first if any changes to Medicaid were to occur?
Yeah, that's a great question. So this issue, as I said up front, really is up for grabs right now. And we saw last week that Politico reported that a number of moderate Republicans went in to meet with the leadership and said, we don't want to see large Medicaid cuts. And so it's very much in flux. There are so many proposals on the table. I mean, there's like 30 or 40 in this long list. So it's hard to say which have more juice. Certainly, I would say Medicaid work reporting requirements is something that's comes up a lot. There are proposals to repeal some regulations that were issued during the Biden era. In fact, one of the eligibility rules that helps people with disabilities and seniors not have so much red tape is one of those that's on the table. So there are a few that we've been hearing about for a while that may have more legs, but I would emphasize that it's just a really fluid situation. We just don't know.
Thank you, Joan. Do we have any other questions in the queue, or would anyone like to be unmuted to ask a question?
Just one other quick thing I want to say, Sonia, is, this is a little wonky of congressional process, but the way that the process will unfold is that the House and Senate will first pass a budget resolution, and that will have very broad strokes with just big numbers and maybe a lot of, there may be some misdirection in the budget resolution. We don't know. But the budget resolution happens first, and that gives committees instructions of how much to cut. And then subsequent to that, we'll see what's called a budget reconciliation bill. And that's where the policies actually get fleshed out. And that's the bill that's protected from the filibuster in the Senate and only requires 51 votes. So first, you'll see this budget resolution. If there's a big cuts number in there that's assigned to the budget function that includes Medicaid, we know that's a big problem. But we won't see any of the details until we get to this budget reconciliation bill, which is the second step.
Great, thank you. And there was a question about the statement you put out, Joan, and we will be including a link to that in the follow-up email to all the attendees, along with a recording of this presser and then a few other resources that folks might find helpful. And just a quick note too, we had some technical difficulties with the Facebook live stream. So we are going to be manually uploading the video to YouTube, and we will include a link to that as well for folks and post it on social media in case people want to watch that way. So I'm not seeing any more questions right now, so I think we are going to wrap this up. Thank you again to all the speakers, the policy folks, and Virginia, Latifa, and Andrea for sharing their stories and how Medicaid has impacted their lives and what would happen if the program was cut. So please be on the lookout to all attendees for the follow-up email that will be sent out early this afternoon. And we hope everyone has a great day. Thanks again for joining us.
Add a little side note.
Bye.
Side note. Oh,